Hello, this is Dr. Aanchal Panth and today we are going to be discussing melasma, its causes and treatment. I make videos on skin related concerns and on hair transplantation. If such content is of interest to you, then please subscribe to the channel. So what is melasma? Melasma is a very common hyperpigmentation disorder in which you see dark spots over sun exposed areas like the cheeks and the nose. It is very common in Indian population. The prevalence of melasma ranges from 4 to 25%. Though more common in women, it is also seen in men. Most of the melasma cases are reported between 30 to 45 years of age. So what is the cause of melasma? The exact cause of melasma is not known, but there are certain well-known risk factors such as exposure to ultraviolet radiation, genetic predisposition, hormonal changes, pregnancy, and intake of oral contraceptive pills. The most important causation of melasma is thought to be sun exposure. It always tends to exacerbate after an episode of sun exposure and tends to improve when the sun exposure is reduced. There is also a strong genetic predisposition in a case of melasma. It is thought that 48% of patients have a positive family history. There are also certain less commonly seen risk factors such as thyroid dysfunction or intake of anti-epileptic medication, allergy to any fragranced cosmetics or emotional stress. In certain studies, they found that even zinc deficiency can lead to melasma. So it has been shown that melanocytes, which are the pigment forming cells, are more active in cases of melasma than in normal skin. So the number of melanocytes are the same. The number of cells have not increased, but the cells are more active and also they are more sensitive to changes of the hormone. That is why certain patients are more prone to develop melasma after intake of oral contraceptive pills than others. It is seen that men who have melasma have a more strong genetic association than women. It is also seen in men who apply mustard oil. So application of mustard oil followed by sun exposure is known to cause melasma in genetically predisposed men. So what are the types of melasma? Melasma is mainly of three types: epidermal, dermal and mixed. So what does this mean? Epidermal melasma means that the pigment is restricted to the top layer of the skin, which is in the epidermis. Dermal melasma means that the pigment is in the dermis layer, which is the deeper layer of the skin. And mixed means that the pigment is both in the epidermal and the dermal layer. It is important to differentiate the melasma because epidermal melasma tends to respond better to treatment than the other types. So how do we treat melasma? The treatment of melasma can be challenging and requires a long-term plan. So do not expect a quick fix or a cure of melasma. There is no cream or a tablet or laser that can completely get rid of melasma. No, you have to be very persistent with treatment and follow long-term sun protection. First and foremost, we always take history about intake of any birth control pills or if you're using any fragranced cosmetic products which could be the reason for your melasma. Also, it is very important to discuss with your dermatologist what all medications you're taking because certain medicines such as anti-epileptic medications could aggravate melasma. So first we look into the detailed history and examine what kind of melasma you have, then we proceed on to treatment. If you are on some birth control pill, then we have to discontinue the pill and put you on some other contraceptive method. The most important aspect of treating melasma is controlling your sun exposure, following very strict sun protection. So you have to use a broad spectrum sunscreen on a regular basis. You have to use a sunscreen with an SPF of at least 30. Apply it over your entire face and neck area and reapply it every 2 to 3 hours. Reapplication is important. There are different types of sunscreen available. If you have oily skin, then you might feel that sunscreen application is making you appear darker and it is kind of aggravating your acne. So we have an entire video on what sunscreen you should use if you have oily skin. You can click on the iCard above to watch it. Strict photoprotection is of paramount importance when it comes to melasma. So along with sunscreen, you have to wear protective clothing such as broad rimmed hat, sunglasses and full sleeves clothing whenever you go out in the sun, especially when you are going out to a beach or you are going to a high altitude area for a vacation. You have to make sure that you are strictly applying sunscreen and covering your face as much as possible. So a sunscreen has to be a part of your daily routine, a part of your life. Okay, so as soon as you get up in the morning and then you apply your moisturizer, you have to apply a layer of sunscreen and reapply it every 2 to 3 hours. Even if you're indoors, you have to have a sunscreen on your skin. So make sure that you're very diligent with sunscreen application. Other than sunscreen, one effective cream that we very frequently prescribe is a hydroquinone cream. Hydroquinone in a concentration of 1 to 4% can be used daily at night over the dark spots. So hydroquinone decreases the amount of melanin produced. So over time it tends to reduce the pigmentation. It has to be used for a period of about 1 to 2 months. Remember that any cream containing hydroquinone should only be used under a dermatologist's supervision. If you use it for a long time, especially if you are dark skinned, then what can happen is it can lead to ochronosis, which is the accumulation of pigment under the skin. This is very difficult to treat. So you have to make sure that you're using hydroquinone only with a prescription and under supervision. A triple combination cream is also commonly prescribed in the case of melasma. This contains a hydroquinone, a tretinoin and a mild steroid such as fluocinolone. So this combination can be given for a period of 1 to 2 months and it has to be applied in a small quantity over the dark spots at night. Make sure that even this triple combination is used only after a doctor's prescription. So this triple combination cream helps in improving the melasma in the first 1 or 2 months, after which we put you on a maintenance therapy. Maintenance therapy should not have any hydroquinone or steroid in it. When we initially start hydroquinone, you may have a little bit of a redness, irritation and little bit of a burning sensation, but over time it will completely resolve. So whenever you start a cream containing hydroquinone, it is suggested that you apply a small amount on your neck first, observe it for about 24 to 48 hours and then go ahead and apply it over your whole face. So these triple combination creams are given for a period of about 1 to 2 months, after which we put you on a non-hydroquinone cream. So remember that hydroquinone should always be used with a doctor's prescription, because a high concentration of hydroquinone can even lead to hypopigmented spots, that means white spots on the face, okay, or can lead to worsening of pigmentation such as dark spots. So you have to make sure that it is applied in a proper concentration for a short period of time. So after using a hydroquinone based cream for a few months, let's say about 2 to 3 months, then we switch over to a cream which does not contain any hydroquinone. So these usually contain azelaic acid, arbutin, ascorbic acid or glycolic acid. So these are depigmenting agents which are safer for long-term use. So azelaic acid is a naturally occurring compound which is derived from a yeast called Pityrosporum ovale. It is usually used in a concentration of 15 to 20%. It can be applied twice a day over the dark spots and you have to follow it up with sunscreen. When you initially start azelaic acid, you may develop a little bit of redness and irritation, but it is usually mild and it completely subsides with continuous use. Other than azelaic acid, we can also use kojic acid, arbutin and licorice extract in order to reduce the pigmentation. These creams are usually used twice a day. Creams containing tretinoin are also used over the dark spots. So what does tretinoin do? It causes increased epidermal turnover, which means that it improves the shedding of the skin. So the overlying dead skin which contains this pigment is shed and the newer fresher skin is light colored. It also helps in increasing the penetration of the other agents. So tretinoin can also be used in cases of melasma. It is applied in a very small quantity only at night. Even glycolic acid creams are used in cases of melasma. So glycolic acid can be used in a very small concentration in combination with other agents such as arbutin or kojic acid and applied on the entire face at night. A higher concentration of glycolic acid such as a 6% or a 12% glycolic acid can be applied once or twice in a week. You must remember that whenever you use glycolic acid or any other depigmenting cream, you have to use a sunscreen. Okay, only then will you see the results of the depigmenting cream. So you have to make sure that you're very diligent with your sunscreen application whenever you're using any kind of skin lightening agents. So treating melasma in a darker skin type is very tricky. We cannot give a very high concentration of any of the agents. It can lead to irritation and even cause post-inflammatory hyperpigmentation, which can lead to worsening of the pigmentation. So we have to be very careful and be very patient with treatment. We cannot give a very high concentration initially. So we usually start with creams and with hydroquinone creams which are of low concentration and slowly build up the concentration and then add on other agents. And we prefer to give a low concentration for a long period of time rather than giving a high concentration for a short period of time, because any agent such as glycolic acid or even hydroquinone when given in a high concentration can lead to irritation and which can cause rebound pigmentation, which is something we do not want. So we have to be very careful when we treat a melasma in dark skinned individuals. So along with these creams, we can also give chemical peeling in cases of melasma. Glycolic acid is the most preferred chemical peel. It is usually used in a concentration of 50%. The peeling can be done once every 2 weeks for the first 1 or 2 months and then can be repeated once in a month, depending upon your response. Other than glycolic acid peels, we can also give Jessner solution or a yellow peel or even a TCA peel. So remember that chemical peels have to be combined with creams. You have to be on some maintenance creams in order to get good results of the peel. So these chemical peels will help in shedding the overlying skin and exposing less pigmented, lighter colored skin, hence improving the appearance of melasma. One very popular drug in treating melasma is tranexamic acid. It is available in oral formulation and can also be given as a cream or as intradermal injections. So tranexamic acid has been found to decrease the formation of melanin in the skin and also reduce the vascular activity. It is given as a daily dose of usually a dose ranging from 500 mg to 750 mg every day for a period of about 3 to 6 months. You have to use this tranexamic acid for at least a month before you can see the results. So this is a very popular treatment now, but remember that it cannot completely cure melasma. It can only reduce it for a short period of time. So I prefer to give tranexamic acid in patients who want a quick improvement and who have a social function to attend or have an important event in their life and they want to clear their melasma. Then tranexamic acid is a good agent to use, but this does not alter the course of melasma in long term. Okay, so this is very important to understand that tranexamic acid cannot completely alter or change the course of your melasma. It can only reduce the melasma for a short period of time, but it is an effective agent. It can also be used, like I said, as intradermal injections. So we first put an anesthesia on your face and then we give very small intradermal injections into your skin, mainly in the affected area. These injections can be given every week for about 4 to 6 weeks. This can lead to a considerable improvement in your melasma. This is usually done in patients who have not responded to other topical treatment. So tranexamic acid is usually considered as a second line treatment. So first we give hydroquinone agents and then a triple combination, or after that we maintain you on non-hydroquinone creams and of course strict sun protection throughout. If these do not give you a good result, then we can add on a oral tranexamic acid for a period of about 3 to 6 months. Before starting tranexamic acid, we look into the history of any kind of vessel occlusion disorder or any kind of heart attack or myocardial infarction that has occurred in the family. These are contraindication for starting tranexamic acid. So if you have any of these conditions, you have to tell your treating physician. So then we do not use tranexamic acid and then go for other treatment in cases of melasma. If there are no contraindications, then tranexamic acid serves as a good alternative. So we look at tranexamic acid as a second line treatment in a case of melasma. Even lasers have been widely used in cases of melasma, but it is not recommended. Lasers are usually the last resort. When no treatment has worked, only then we want to resort to using lasers in a case of melasma. The lasers which are most commonly used are Q-switched Nd:YAG laser and fractional CO2 laser, both of which are very tricky in cases of dark-skinned individuals. Okay, it can lead to post-inflammatory hyperpigmentation and sometimes can lead to worsening of the dark spots. So we have to use it with a lot of caution. So I do not encourage taking laser treatment at the first go itself. It is always better to first start with creams and oral medications if need be, and then if we do not see any improvement with these agents, then only we want to use lasers. Okay, so lasers have to be used with a lot of caution in a case of melasma. Lasers are expensive and also require multiple sessions, and the results are not very predictable. Some patients might show very good results and may even attain remission of their melasma, but in most patients, melasma tends to recur after stopping the laser treatment. So it is very important to understand the risk factors of taking lasers, and also understand that it is very important to practice strict sun protection before and after taking the laser sessions. So after understanding all the risk, you can take an informed decision whether you want to go ahead with lasers or not. So what is it that I want you to understand from this video? I want you to know that melasma is a long-term condition. It cannot be completely treated with just 1 or 2 creams. You have to make a lifestyle modification. Make sure that you reduce your sun exposure and you apply creams as prescribed regularly. Okay, so we do approach melasma in a stepwise manner. So first it is always sun protection, then we give hydroquinone creams, then we maintain you on non-hydroquinone creams, and then if this does not help in attaining the kind of results, then we add on certain chemical peels and tranexamic acid, and then we can give lasers. So lasers is always the last resort. I want you to understand that you have to be very patient when you're treating melasma, and we do not want to use any cream which has the potential to worsen the condition. So we want to go very slow, use safe creams, and give you a treatment plan for about 6 to 8 months, and then see the results. So you have to be very patient with therapy when it comes to treating melasma. I hope you found this video useful. For more skin and hair related content, you can follow me on other social media handles such as Instagram, Facebook and Twitter. Thank you for watching.